12 early signs of liver cirrhosis. Liver cirrhosis is a silent killer. It's one of those diseases that can creep up on you without warning, often presenting no symptoms until it's too late. Cirrhosis, which occurs when the liver becomes severely scarred, can result from various causes, including chronic alcohol use, viral infections like hepatitis, or fatty liver disease. What's more alarming is that many people don't even realize they're at risk until they're in the advanced stages of the disease. In fact, cirrhosis is one of the leading causes of liver failure worldwide, contributing to over 2 million deaths annually. The problem is that by the time cirrhosis causes noticeable symptoms, the liver may have already sustained irreversible damage, making early intervention crucial. This is why understanding the early signs of liver cirrhosis is essential. Today, we'll discuss the 12 early signs of liver cirrhosis, why they happen, and how recognizing them can potentially save your life. The liver is the body's detox center, and if it's not functioning properly, everything else can fall apart. But when caught early, certain interventions can halt or even reverse the damage. So let's dive deep into what those early warning signs are, how they show up in your body, and why you should take action sooner rather than later. One of the earliest signs to watch out for is fatigue. At first, it might seem like you're just tired from a busy schedule or stress, but when your liver begins to fail, it can no longer filter toxins efficiently, leading to an overwhelming sense of tiredness. This happens because your body becomes overloaded with waste products, like ammonia and other toxins, that the liver would typically remove. As the liver's function declines, these toxins build up in your bloodstream, causing exhaustion and a lack of energy. Interestingly, fatigue in liver cirrhosis can be more than just a feeling of tiredness. It can be debilitating. Research shows that up to 80% of patients with advanced liver disease report fatigue as a major symptom. It's one of the earliest signs, yet it often gets overlooked, partly because it's easy to attribute it to other factors like stress or poor sleep. But the truth is, when the liver is struggling, it disrupts the body's metabolism, impacting energy production and nutrient processing. As the liver's ability to convert food into usable energy diminishes, people with cirrhosis feel drained even after a full night's rest. This kind of fatigue doesn't just affect your daily activities. It can impact your overall quality of life. A shocking statistic shows that over 60% of cirrhosis patients experience chronic fatigue, which can significantly decrease their ability to work, engage in social activities, and maintain a healthy lifestyle. So, if fatigue persists and no other explanation seems to fit, it's time to consider your liver health. Another sign is unexplained weight loss. This can be particularly alarming because it often occurs without any obvious cause. When the liver becomes scarred, it starts to lose its ability to store nutrients and regulate metabolism properly. The liver plays a critical role in breaking down fats and processing nutrients, but when it's damaged, its ability to perform these functions significantly decreases. This can lead to the body not absorbing enough nutrients from food, which can cause unintended weight loss. In addition, a compromised liver struggles to produce bile, which is essential for digesting fats. Without adequate bile production, the body can't properly digest and absorb fat, leading to malnutrition and weight loss. It's not just about the calories you eat. The liver's inability to process those calories effectively means that your body isn't getting the nutrients it needs, even if you're eating regularly. Shocking as it may sound, unexplained weight loss is common in liver cirrhosis. Studies show that more than 50% of people with cirrhosis experience unintentional weight loss, often in the earlier stages of the disease. This can be a warning sign that the liver is no longer functioning at full capacity. So, if you notice a significant, unexplained drop in weight, especially if it happens quickly, it's definitely something to pay attention to. It's always better to address these changes early rather than wait until the issue becomes more complicated. Jaundice, or the yellowing of the skin and eyes, is another glaring sign of liver cirrhosis. This noticeable change in appearance happens when the liver can no longer process bilirubin, a byproduct of red blood cell breakdown. Under normal circumstances, bilirubin is filtered out by the liver and excreted through bile. But when the liver becomes damaged and loses its ability to perform this function, bilirubin accumulates in the bloodstream. As a result, it starts to deposit in various tissues, causing the skin and the whites of the eyes, sclera, to take on a yellowish tint. Jaundice is not just a cosmetic issue. It's a clear signal that the liver is in trouble. In fact, jaundice is one of the most visible and alarming symptoms of liver cirrhosis. Research shows that jaundice appears in up to 40% of cirrhosis patients, particularly in the later stages. It's essential to take this seriously, as jaundice indicates that the liver's ability to detoxify the body is severely compromised. If you notice any yellowing in your skin or eyes, it's important to seek medical attention promptly to assess liver function and prevent further damage. While jaundice itself may not be painful, it often accompanies other more severe symptoms, such as fatigue, weight loss, and abdominal swelling. These combined signs can significantly affect your quality of life, making early diagnosis and intervention critical. So, if you notice any yellowing, especially in the whites of your eyes, don't wait. Get your liver function checked right away. Early detection can help slow the progression of cirrhosis and potentially reverse some of the damage. Swelling in the abdomen, known as ascites, is another early symptom of liver cirrhosis. This occurs when the liver loses its ability to produce albumin, a protein that helps keep fluid within the blood vessels. Without enough albumin, fluid starts to leak into the abdominal cavity, leading to a buildup of excess fluid, which causes the abdomen to swell. Ascites can be incredibly uncomfortable, making your stomach feel bloated, distended, or even painful. As the fluid accumulates, you may notice that your pants feel tighter around your waist, or that you experience a sense of fullness and discomfort, even after eating just a small amount of food. The presence of ascites is often a sign that cirrhosis has progressed to a more advanced stage. It's important to understand that ascites don't just result from overeating or indigestion. It's a clear indication that something more serious is going on with your liver. In fact, ascites occur in about 50% of people with cirrhosis within 10 years of diagnosis, and it can be a sign that liver function is deteriorating rapidly. This accumulation of fluid can also lead to additional complications, like infections, difficulty breathing, and even kidney problems. If you start noticing swelling in your abdomen, especially if it seems to get worse over time, it's crucial to seek medical attention. The sooner ascites are diagnosed and treated, the better the chances of preventing further liver damage and improving overall health. While lifestyle changes like reducing salt intake can help manage ascites, addressing the underlying liver disease is key to preventing it from getting worse. Easy bruising or bleeding is also a sign of liver cirrhosis. As the liver becomes damaged, it loses its ability to produce the clotting factors that are essential for blood to clot properly. These clotting factors are proteins produced by the liver, and when liver function declines, the production of these proteins decreases. As a result, the body's natural ability to stop bleeding is impaired, making you more susceptible to bruising and spontaneous bleeding. You may notice unexplained bruises appearing on your body, often without any significant injury or trauma. Even minor bumps can result in large, visible bruises that take longer than usual to heal. Another common issue is frequent nosebleeds, which occur because the blood vessels in the nose are more fragile when clotting factors are insufficient. When the liver isn't functioning properly, it affects the entire clotting system, leading to increased bruising and a higher risk of bleeding, even from small cuts or scrapes. This symptom is a serious sign of liver dysfunction. In fact, easy bruising or excessive bleeding is seen in many cirrhosis patients. and it's one of the key indicators that the liver's ability to produce vital clotting proteins has been compromised. Addressing liver damage early can help prevent these bleeding issues from becoming more severe and affecting your overall health. Changes in your urine and stool color can also provide important clues about liver health. Dark, amber-colored urine or light-colored stools indicate that the liver is struggling to function properly. When the liver isn't processing bilirubin, a byproduct of red blood cell breakdown, as it should, bilirubin can accumulate in the bloodstream. This buildup of bilirubin is what causes the urine to turn darker, often resembling the color of amber or tea. Dark urine occurs because the excess bilirubin is excreted through the kidneys instead of being processed by the liver and eliminated through bile. On the flip side, if the liver is not producing bile, an essential digestive fluid, it can result in pale, clay-colored stools. Bile is responsible for giving stool its typical brown color, so without it, the stool loses its usual hue. This happens because bile is needed to break down and absorb fats in the digestive system, and without it, the stool remains light in color, indicating a lack of proper digestion. These color changes can be an early red flag that something is wrong with your liver. It's especially concerning when both dark urine and pale stools occur together, as it can suggest that the liver is not functioning at full capacity. If you notice any drastic changes in the color of your urine or stool, it's important to consult with a healthcare provider right away. Another sign is itchy skin, which can be particularly bothersome. When the liver is not functioning properly, bile starts to build up in the body, a condition known as cholestasis. This buildup of bile salts under the skin leads to intense itching or pruritus. The itching can become so severe that it disrupts daily activities and even sleep, making it much more than just a minor annoyance. The frustrating part is that the itching often occurs without any visible rash, which makes it even harder to diagnose. The mechanism behind this is that when the liver is damaged, it can't properly process and eliminate bile, which is supposed to be excreted into the digestive system. Instead, the excess bile accumulates in the bloodstream and deposits in tissues, including the skin. The presence of these bile salts in the skin triggers the sensation of itching, which can be widespread or focused in certain areas, like the hands, feet, or back. It's important to pay attention if you're experiencing persistent itching, particularly if any rash or other skin changes do not accompany it. In fact, pruritus affects up to 20 to 30% of people with liver disease, especially those with cirrhosis or chronic cholestasis. If the itching becomes unbearable or chronic, it could be a sign of liver dysfunction, and it's crucial to get your liver health checked. Confusion or difficulty concentrating, also known as hepatic encephalopathy, can occur as the liver's ability to filter toxins diminishes. When the liver is no longer able to process and eliminate waste products, especially ammonia, effectively, these toxins begin to build up in the bloodstream. Ammonia, which is a byproduct of protein digestion, is normally broken down in the liver and excreted through urine. However, in liver failure, the liver can't perform this task, and the excess ammonia affects the brain, leading to a range of cognitive and mental symptoms. This accumulation of toxins can cause confusion, forgetfulness, and even personality changes, making it difficult to think clearly or concentrate on tasks. You may find yourself feeling foggy or unable to focus the way you used to. In more severe cases, people with hepatic encephalopathy can experience disorientation, agitation, and impaired decision-making abilities. It's a gradual process, but it can significantly interfere with daily life and well-being. Studies show that up to 70% of people with advanced liver disease experience some form of hepatic encephalopathy. It's often an early warning sign that liver function is deteriorating. If you begin noticing any changes in your memory, concentration, or mental clarity, it's crucial to seek medical advice. Another subtle sign is the development of spider-like blood vessels on your skin, known as spider angiomas. These small red web-like veins often appear on your face, chest, or hands and are a result of hormonal imbalances caused by liver dysfunction. When the liver is damaged, it becomes less efficient at metabolizing and processing hormones, particularly estrogen. The buildup of these hormones can cause the blood vessels near the surface of the skin to dilate, forming these distinctive spider-like patterns. Though spider angiomas may seem harmless at first, they are often an early warning sign that the liver's ability to manage hormones and other metabolic processes is compromised. These small vessels can be a clue that your liver is struggling to maintain its usual balance of hormones, which is critical for regulating various bodily functions. They may appear in clusters and can vary in size, but they are more noticeable in some individuals than others. It's important to keep an eye on any new or unexplained skin changes, especially if these spider-like veins start to appear in multiple locations. Spider angiomas are commonly found in people with liver cirrhosis, and they occur in approximately 30 to 50% of individuals with advanced liver disease. While they aren't typically painful, their appearance can indicate that your liver is no longer functioning at full capacity, making it a sign worth discussing with your healthcare provider. Nausea and vomiting are common signs of liver cirrhosis as well. When the liver is unable to process toxins properly due to its reduced function, these toxins can build up in the bloodstream and disrupt the body's systems. One of the first areas affected is the digestive system, which leads to the sensation of nausea. The accumulation of toxins like ammonia, which the liver usually clears, can cause discomfort in the stomach and digestive tract. This can escalate into vomiting as the body tries to expel these harmful substances. Additionally, nausea often comes hand in hand with a loss of appetite, making it difficult for individuals to eat or maintain a regular diet. The reduced appetite, combined with the feeling of nausea, can lead to unintentional weight loss and nutritional deficiencies. For people with cirrhosis, maintaining a balanced diet becomes increasingly challenging as these symptoms persist. This symptom can be particularly concerning because it significantly affects daily life, interfering with eating habits, overall nutrition, and daily routines. Research has shown that up to 60% of people with advanced cirrhosis report experiencing nausea and vomiting, with many also experiencing a reduced appetite. If these symptoms are present, it's important to consult a healthcare provider to assess liver function and manage the underlying causes of nausea, as early intervention can prevent further complications and improve quality of life. Finally, pain in the upper right side of the abdomen is another sign of liver cirrhosis. As the liver becomes inflamed or enlarged, it can put pressure on the surrounding organs, leading to discomfort or pain in that area. This pain may be dull, persistent, or sharp, and it can sometimes be mistaken for something less serious, like indigestion or muscle strain. However, when the liver is affected by cirrhosis, it may start to swell due to inflammation, which can cause the capsule that surrounds the liver to stretch, leading to pain. The pain can vary in intensity, sometimes increasing after eating or with certain movements, as the liver is positioned near the stomach and intestines. While this pain might not always be excruciating, it's often persistent and can become more noticeable as cirrhosis progresses. The liver's enlargement can also be accompanied by other symptoms, such as fatigue or jaundice, making the pain in the upper right abdomen even more telling. If you notice persistent pain in this area, it's important not to ignore it, especially if it doesn't go away or worsens over time. In fact, about 50% of people with liver cirrhosis report experiencing some form of abdominal pain. It could be an indication that the liver is inflamed, and addressing the underlying cause early on can help manage the disease and prevent further complications. Now that we've covered these signs, it's important to remember that catching liver cirrhosis early is crucial. By making lifestyle changes like reducing alcohol consumption, eating a liver-friendly diet, and exercising regularly, you can support your liver health. Vitamin-rich foods that support liver function, like those rich in antioxidants, vitamin D, and vitamin K, can also help. For instance, antioxidants like those found in leafy greens and berries can reduce oxidative stress on the liver. Similarly, vitamin D helps reduce inflammation, which is key to slowing down liver damage. Proper hydration, along with regular intake of certain herbs and supplements like milk thistle, can also support liver function. The earlier you take action, the better your chances of managing or even reversing liver cirrhosis. So don't ignore these signs. Pay attention to what your body is telling you and take proactive steps toward your liver health. After all, the liver is one of the most vital organs in your body, and protecting it could make all the difference. Thank you so much for watching. We hope you found this information helpful and that it gave you a better understanding of the early signs of liver cirrhosis. If you found this video valuable, remember to like, comment, and subscribe for more health tips. Stay informed, stay healthy, and take care of your liver.